All right, hopefully this works. I've been having a heck of a time trying to get a video loaded and recorded for YouTube for you guys. So, met with my radiation oncologist, met with a few doctors, and there's so much going on and so much information to talk about. It's easier to try to do it this way if this even works, opposed to trying to type it all in. So, as you guys know, I've been back and forth with not sure what to do as far as the cancer radiation treatments and so forth. So with meeting with them in the very beginning of all this, we were told, or I was told about there was a possibility that I would be able to do a trial of a medication that might be able to block the cancer so that it would not hopefully continue to spread in the areas that it's in. Doesn't mean it can't grow in different areas, but the areas that it's in, it would help to seclude it there. So we've known about that. But there's a lot of roads you have to go down to get to that point to see if you even qualify, if it's going to work for you to get on the trial, whatever. So now we're kind of at that point. We're almost there. So in order for me to get there, I have to do one more dose of the radioactive iodine. And I've only had one so far, and it did help a little bit, but was not successful, obviously, in getting rid of the cancer. So we know doing another one is not going to get rid of it either. However, it will help shrink it down and kind of keep things at bay for a while, hopefully. So after doing this one, they want to do it in July, or not in July, they want to do it in January. So doing this one in January, then going through the whole body scan, blood work, and a bunch of other things that need to be done when I don't know what all that is right now. Then the next step would be looking into a drug. So the drug that they're looking into is called, I don't even know how to pronounce this, VITRAKVI. Vidracvi. I don't know. This is the name brand of it. And in order to qualify for this, I need to do one more round of the radioactive iodine, show that that's not taking away the cancer. And even though it is shrinking it down, helping a little bit, but it's not taking it away and the cancer's still growing, then this would be the next step if I chose to do this. It is extremely expensive, which is the least of my concern because there are grants out there. There's funding and discounts, and I do have insurance and stuff. So right now, this is the least of my concern. But I can share the prices with you guys. I'll upload them onto the journal page. So here's the issue with this. This medication is in phase 2 of the trial. I don't have issues with doing trials. But there's so much stuff with this. This is not a chemotherapy medication. Chemotherapy will not help the type of cancer that I have, the papillary carcinoma. And an interesting thing that we have discovered, I did genome testing in the very beginning of all this. And it turns out that I have another issue. And the issue makes life a little bit more interesting. I have NTRK1 fusion cancer. It is not a separate cancer than the thyroid cancer. I don't know a ton about this. I've been researching it myself. And when you do the genome testing, it's like a genetic testing to help figure out what's going on and different things that you might be carrying. So I have an abnormal gene, NTRK1, and trying to look through read this. You can have the fusion cancer. It can happen in both adults and children. The location of a tumor can vary from person to person, but the cause is the same, an NTRK gene fusion. And having this fusion cancer does not change your original diagnosis. It just explains the cause of it. However, it does not explain why I have thyroid cancer. And it says how the testing can reveal whether or not you have it. And then this medication is a prescription medication that is used to treat adults and children with solid tumors that are caused by certain abnormal NTRK genes, have spread, or if surgery to remove their cancer is likely to cause severe complications, and if there is no acceptable treatment option where the cancer grew or spread on other treatment. So for me, there is no acceptable treatment option because it turns out that I have a gene that is not going to react to cancer treatment. So going through this testing and the genome testing and looking at all this, unfortunately, my body is not able to respond to certain medications and certain things such as cancer treatment. So with that being said, there is not a whole lot to offer me. So they told me that I have to very quickly come up with a decision and do the radioactive iodine as soon as possible. They know that I want to look into things, not do jump on stuff, and I don't want the radioactive iodine unless it's absolutely necessary for multiple reasons. And was told that I don't have a lot of time to make the decision, that it needs to be done as soon as possible, that I cannot even wait 3 months, 6 months, whatever. Why? Because the longer you wait, the harder it is to treat and do anything. So because of that, I said, okay, we will do one more of the radioactive iodine, but I will not do it until after Christmas because of how sick it makes me and how bad I am. So we decided that we'll do it. They're thinking about January. So the last week of December, I will have the normal thyroid panel done. I don't know if they're putting in any other blood tests with that, but I'm going to have a normal workup done. And then, which is what we did last time as well. It's all the same blood work that I just had done. I have it usually every 3 months or so. So anyway, then that will help determine the dosing and such. But he is thinking that it'll be the same dose of last time, which is 160. He says that due to the advanced stage cancer that I should have a higher dosing, but because my lungs are fragile and can only take so much, that's why he only did the 160 last time, and he doesn't want to go any higher than that this time. So this will be the very last, as of right now, the very last radioactive iodine treatment that I can have. We know that it's not going to cure the cancer and take all the cancer away. We know it's going to target some of it. We know it's going to possibly shrink some of it. We know that end result, there is going to be live active cancer cells, whether they're going to be growing and doing things at the time or if they're going to kind of be stable and not be doing what cancer does. That part, no one can answer right now. But we also know that there's a very good possibility that sometime after having this done and having more testing done, that we're going to continue watching the cancer marker climb and see more cancer on scans. So when that happens, then, like it has happened more than once now, then the decision is going to have to be talked about and made about do we want to try this, or do I want to try this medication? It was pushed through the FDA very quickly, even though it's only in phase 2 of the trial. And I have not made a decision what I'm going to do yet, but here's the thing. This is my last resort. There is nothing else that can be offered to me because I have the genes that are not going to allow treatment to put me in remission with cancer. There's only so much that can be done. So here's things with this, and I will take pictures of this stuff and put it on the journal page as well. How long patients respond to the treatment. In patients who had their tumors disappeared or shrink, the response only lasted 1.6 months and up to 33 months. 73% of patients had a response that lasted for 6 months. 63% of patients had a response that lasted for 9 months. 39% of patients had a response that lasted for 12 months. The median time it took patients to respond to the treatment was less than 2 months. However, some people only had a response for 6 months. So that's not very promising. So it's hard to say how this is going to react with anyone because it is still in trial. There is a ton of side effects of this. Nervous system problems is one of the big ones. So what happens with it is symptoms such as confusion, difficulty speaking, dizziness, coordination problems, tingling, numbness that people have been having in their face, hands, and other areas of their body, burning sensation in your hands and feet. Then we have liver problems. We have loss of appetite as well as nausea and vomiting, pain in the upper right side of your stomach area. There's a lot of GI problems with this. Tiredness, there's dizziness, there's vomiting, there's cough, there's constipation, there's diarrhea. There is people that are experiencing a lot of bone fractures because another issue is not being able to maintain calcium levels, which is already an issue for me, as well as vitamin D and vitamin B. And I did the bone density test, which came back positive for me having low bone density, but it's mild, and that can happen with people. It's not necessarily anything to do with the cancer. But there's a lot of people that have bone fractures that have been on this. Another thing with this is there's a lot of people stating that they are having issues with detoxing in between this. So everything that I've read and all the people that have testimonials out with this and stuff that that have been telling things that they've been going through with these trials, you take 100 milligrams twice a day of a pill. The milligrams or the pills come out to approximately almost $200 per pill. This is before insurance, before anything. And then there's a 25 milligram pill that, with what everyone is telling me and what I have read, can be taken in between those to help with people that feel like they're going through withdrawal in between the periods of taking these two 100 milligram pills. Then people are saying that people that are having a lot of problems with it and then have to have it stopped are going through withdrawals. There's so much stuff on here that people don't even know about this yet. And so I have to do a lot more research, a lot more things that I need to look into. Some of the adverse reactions, you've got the skeletal pain, muscular weakness, fatigue. You've got edema, you've got cough, dyspnea, upper respiratory tract infections, nasal congestion, dizziness, the headache, the cognitive impairment, abdominal pain, rash, mood disorder, sleep disturbance, increased weight gain, decreased appetite, urinary tract infection, the vomiting, the nausea, the diarrhea. There's just, the list goes on and on and on of what people have experienced. It's obviously different with everybody. Not everyone is going to have the same experiences. Some people may not experience anything. So there's a lot of blood work that has to be done with this from what I have seen, to check liver enzymes and other things. So I don't know, but I am, according to the testing, able to try this. This is really all they have left as of this point to offer. So adult and pediatric patients with the body surface area, there's just so much on here that I can't even explain and to put into English without even looking this up and doing research myself to understand what all this even means. Obviously, I'm not a doctor, and my doctor doesn't even know a lot of stuff about this yet either, with it being so new. So I'd have to put stuff on here that you withhold it until adverse reaction resolves or impresses to baseline, and then resume at the next lower dose if resolution occurs within 4 weeks. Permanently discontinue it if an adverse reaction does not resolve within 4 weeks. Permanently discontinue it in patients who are unable to tolerate it after 3 dose modifications. So there's people that have been on this for quite some time, having issues with this, but they're still continuing to take it. So I don't know exactly how they decide who should continue it, who should not, if it's how bad the symptoms are, how bad people are reacting to it. I truly don't know. Some people are having positive results. Some people are not. Some people are having the cancer continue to spread while they're on it. Others are not having that issue. There's some reports saying that the cancer has shrunk with it. Others are saying it has not. It's just blocked it. But then when stopped, it grows pretty quickly afterwards. So there's just so much unknowns about this. So again, I'm not against trials or anything like that. I'm willing to do things like that, especially if it's going to help other people. There's just a lot of questions I have about this. So it's pretty much where we're at right now, is discovering that, going through and breaking down everything and looking at all the stuff in the genome testing, that my body is not able to, unfortunately, respond the way we would like it to with any type, I shouldn't say any type, but with different types of medication. Chemo is one of them. The radioactive iodine is another one. And so doing this next radioactive iodine is important. It needs to be done just because you need to have more than one to prove that it's not going to work and that your body is resistant to it before you can start a trial. So that's why it's necessary to do this, and it needs to be done sooner than later, before it gets to the point, according to the doctors, that my body will not be able to react to any type of treatment at that point, and then there's absolutely nothing that can be done. So with there being a resistance to cancer medications, not all of, I don't want to say all of them, I don't know exactly which medications I am resistant to, aside from the radioactive iodine and I know that there's chemo meds that I am resistant to. I just don't know what they are. But it doesn't matter because, again, chemo is not even an option for this anyway, and for the papillary thyroid cancer. So that's pretty much where we're sitting at. NTRK1 fusion thyroid cancer. Again, NTRK1 is not a separate cancer, from what I'm understanding. However, it can cause cancer to spread and grow at different rates. So there's so much reading on this and a lot more that I have to understand and process, as do the doctors and stuff with this new medication. So I have not made a decision yet. I do have this new toothpaste here. You probably can't see it. It's backwards on there. It's a dental gel. It's not really toothpaste. It's a gel that I have to use for my teeth now because they keep breaking and having issues from the radioactive iodine and the cancer itself, which I guess is normal for all of this. But so the dentist gave me this. It's a dental gel. It's I have to have high fluoride toothpaste, and this is after brushing your teeth at night. You put this on your teeth at night, and it's just a gel, and you leave it on, and it's supposed to help make your teeth stronger. So this is something that is new that's been added on that I'll be doing. Every night I only have to use it once a day, so not when I brush my teeth any other time during the day. It's only at night. When I do that, and then see if that works at all, and then try to get some repair done on the dental stuff that I've got going on. But we have to see about having what can be done before the next radioactive iodine. With that being said, I really have no answers for questions that you probably have. I have questions that don't have answers to them. The doctor can't even answer all the questions because this is a very new drug. We talked about this in the beginning, but in the beginning we did not know how much, you don't know how your body's going to react to medications or treatments or anything with cancer or any other illness or whatever you have, but until you have it and you do testing and whatever, and that's what we did. So now that we know what's going on and why the cancer wants to keep growing and doing what cancer does, we have to try to, one day at a time, just keep facing it. So that's pretty much where we're at. I'm still extremely tired from lack of sleep. My new bed came, but I've been up late reading and studying and trying to learn this stuff. So I'm exhausted. It's still working every day that I possibly can. And of course, getting ready for Thanksgiving. So once I have more information and I know more, I will tell you. People have asked about prognosis. That's not something that can be answered. A doctor cannot even give that. That right now, that's a very difficult thing for anyone to be able to say. If I did have a prognosis, I wouldn't tell you anyway. I don't need you looking at a calendar. But I don't have one. So we can hope it'll be 10 years, 20 years, 5 years. No idea. Can people die from thyroid cancer? Yes. Do they die from it? Yes. Am I going to die from it? I have no idea. But this is just where we're sitting at. We have a lot of unanswered questions, and hopefully we will start getting them answered soon. If you have questions, keep sending them to me. I will try to get answers. I will do videos when I can and post them on there because sometimes it's easier, especially when I'm so tired. and see what we can do. So I'm going to, I started a YouTube channel. If I did it right, it's not going to be a public one. Everything's going to be private on there, so I can just record and then upload it onto the journal page. I don't know if I'm going to do it right, so we'll find out with this one since it's the first time I'm doing this. So I will, people have been asking about the bed. I will do a video of it, not tonight. I am way too tired. And let you guys see what it is that I got and how it works. My grandson loves it. He thinks it's the greatest thing in the world, and he thinks it's an airplane ride. So he wants to play with my bed constantly. He loves it. So it's been approved by a 2-year-old. So that's it for now. I'm going to try to get some rest because I am absolutely exhausted and can't even completely think straight right now. But and I have to work 12 hours tomorrow. But once I know more and I can sort through more of the stuff and my notes, then I will do another video, try to explain things. I will take pictures of this stuff and put it on the journal page. You're more than welcome to do your own research. Just be careful what you research. You cannot obviously believe everything you read, so be very careful with it. I'm only going to the website for the exact website for this medication, Mayo Clinic, Cancer Centers of America. There's certain things that I'm going to in doing research on. You can't just rely on everything that you're reading. So be very careful on any research you're doing for yourself, your family, or otherwise. So anyway, I will post this stuff and hopefully this video uploads.